All right, guys, we're going to dive into the prescription drug plan or Part D coverage of Medicare and who's eligible and how you get Part D coverage. So in general, you may enroll into a prescription drug plan if you're enrolled into Part A and or Part B. So you don't have to have Part B to enroll into a Medicare prescription drug plan. Remember, if you're enrolling into a Medicare Advantage plan, you have to have both parts, Part A and Part B. That forms like this key that unlocks the door to enroll into a Medicare Advantage plan. The same thing here in a few minutes when we cover the Medicare supplement, you have to have Part A and Part B. But Medicare prescription drug plans, you can have Part A or Part B, either or, and enroll into a prescription drug plan. In addition, you must live in the service area of the Part D plan. Again, the Part D plans are determined by the county, not the state. So again, we would review your medication, your Part D plan needs, and then we would put it into our software platform, hit a button, it would tell us within a few seconds of what Part D plans are going to be available there based on the price and the copay. It's going to always tell us the lowest to the highest. It's a very simple way to just figure out what am I going to go on that's going to cost me the least amount of money and cover my medication, but it's based off the county need. So what does Part D coverage cover? And then Medicare's approved list of medications, how does that really work? So formularies on prescription drug plans are all different. Deductibles and copays or cost share are different as well. So I like to use this analogy. If this table, Medicare has a list of medications that they deemed approved that Medicare prescription drug plans, Part D plans, can choose from this big list of medications. So let's say this table represents all the prescription drug plans available through Medicare. Medicare's approved all these medications. So how that's broken down into category is going to be like blood pressure, cholesterol, insulin. So every category has to have at least 2 medications or more. Now some medication categories are going to have multiple meds available in it. Some may have less, but typically you're going to have 2 or more in every category. And Medicare says if you're going to be a prescription drug plan approved by Medicare, that you have to have at least 2 medications on each category. And you have to choose from the list of medications that's on our list. So formularies are derived depending on the plan, the Part D plan, and what they're trying to do. Sometimes they look at fixed and lower income people and they derive a formulary based on the needs of those people. And they pull together these medications off this big plan list out of the categories and create a formulary. And then out of that, it's going to have either deductibles or no deductibles, and then certain copays, depending on the tiers and the level of what they place that medication at. They can put it at a tier 1, tier 2, which are typically generic, or tier 3, which are typically name brand drugs, or tier 4 or tier 5, which are specialty or non-preferred brand drugs. Most people are not on tier 4 and tier 5 drugs, but they are available if that person needs to be prescribed by the doctor. And then they also have what they call select tier or tier 6 medications. And a lot of times those are low cost maintenance medications that plans will choose to have at a 0 cost. So why does it have a 0 cost? Well, really, it's the health plan or prescription drug plan trying to regulate whether or not you're taking the medication and regulating that maintenance issue in your life. It may be high blood pressure, cholesterol. The health plans want to know, hey, are they taking the medication? Well, guess what? If it doesn't cost you anything, it's a lot better driving force that you're going to have the medication prescribed, take the medication, and then your illness that you're facing that medication is helping with is being maintained, like high blood pressure. So it puts you at a lower risk, is their viewpoint. It puts you at a lower risk for heart disease, heart conditions, and things like that if you're taking a blood pressure maintenance medication. So that is how the prescription drug plan formulary works. Medicare approves this big list of medications. Health plans or prescription drug plans that are going to choose to put together a Part D plan have to choose from that big list of medications. They have to have at least 2 medications per category, like blood pressure medicines. There has to be at least 2 or more, cholesterol 2 or more, and so on. It helps pay for the medication your doctors prescribe. That's one of the reasons why we enroll people into a prescription drug plan, because Part A and Part B of Medicare does not cover prescription drug coverage, okay? So you enroll into a prescription drug plan because it's going to provide you prescription drug coverage. Typically, it's going to cost you less money than just going to a pharmacy and saying, hey, I want a cash pay. Now, I will say this. Sometimes we are finding members or clients of ours that'll go in and they use a savers program, or they use GoodRx, or they'll use some type of service that has a discounted amount for certain medications, and they use that to get some of their medications, and then they use their prescription drug plan coverage to get their other medications at the lowest cost. Well, common sense would be like using coupons. If it provides you less cost by using something like a program that you have that you pick up like GoodRx, and it doesn't cost you anything to do that, or just ask them, hey, if I pay cash for this and not use my insurance, what is the cash pay option? If you go to certain places like Publix and things like that, and they have medications listed on a maintenance medication list of medications program, they may have a $0 to $4 cost, and your prescription drug copay may be $5. Well, if it's $0 or $4, guess what? I would buy it through a cash pay option. Or GoodRx, if it's going to save you $20, buy it through GoodRx. Great. Save you the most money, the most possible ways that you can. The health plans want you to fill the prescription drug plan through them because they want to regulate whether or not you're taking the medication and all these other moving factors, because they're a healthcare company. They're trying to drive profit by maintaining a lower risk or medical loss ratios. So they want to keep your loss for health at a minimum. They do that through prescribing the benefit of allowing you to take maintenance medications and medications at a lower cost. Well, if it's a lower cost, guess what? It drives you to take that medicine on an ongoing basis. Now, I won't get into the whole model of healthcare and my view on a lot of things, but a lot of times, you are wise enough to figure out, a little diet and exercise eliminates the medication. And so you do diet and exercise and come off the medication. Your doctors typically will drive you towards that. But the health plan just looks at if you're prescribed a drug and it's in your charts, they want to see that you're taking that medicine. And so the only thing that's going to contribute to moving parts to if you use it on a cash pay basis as opposed to using your insurance is not going to show up in your chart. You're still getting prescribed by the medication, or the medication's prescribed by the doctor, but it's not going through the health plan, okay? But again, that's not for you to manage. That's the health plan trying to manage over how they deliver health care. They may call and engage you to do mail orders. Guess what? If you want to do mail order, do it. If you don't want to do it, don't do it. It's your choice. You're not mandated to do it a certain way. If you ask my opinion, I may have an opinion on how to pick up prescription. Well, guess what? You don't do it even according to my way. That's just the way I would do it for myself. You do what's best for you. When it comes to your pocketbook, what's going to drive the lowest cost for you as well. So prescription drug plans help lower the prescription drug cost. Some Medicare Advantage plans, a lot of Medicare Advantage plans are going to offer a built-in prescription drug coverage. We talked about this earlier because they're called MAPD plans. PD is prescription drug plans. So if that plan has a drug plan in it, it's going to function the same way. A big list of drugs, choose a formulary, put it into the plan. They're going to have at least equal to what Medicare deems as approved drugs. There's going to be at least 2 drugs or more on the formulary for every category of need that there are when it comes to a Medicare approved category, okay? So another thing, a little side note, I call them performance medications. There's certain medications that certain people take for performance matrix, a lot of times men, which is fine. If you're prescribed that type of medication is not going to be covered on a prescription drug plan that's Medicare approved. It's like cosmetic surgery, ladies. If you want a nip and tuck, if you want a little Botox injection here and there, you know what? Knock yourself out. If you've earned the money to be able to pay for it, go out there and celebrate the win and get some Botox. Whatever makes you happy is fine with me. But if you do that and you try to have it done or ran through your insurance, you're going to find that Medicare does not approve cosmetic surgery. It's not going to improve certain medications that contribute beyond a medical need that they seem that falls under Part A and Part B services, okay? So if it's not a mandated medical need, the prescription drug is not going to cover it, and then if it's a medical care need like cosmetic surgery, you're going to pay out of pocket for that, okay? So just so you know that, sometimes a medication that you're prescribed is not going to be covered by the formulary, but the doctor is going to say this is the only medication that's going to take care of this specific need. And they're going to do a formulary exemption request. They're going to send that into the prescription drug carrier or your Medicare Advantage carrier and ask for an exemption. Sometimes they will reject it. You will appeal it. They will place it onto the formulary. A lot of times it's going to be placed on Tier 4 on your formulary, okay? those are a lot of moving parts, and you may not ever face that, but if you do, and you're dealing with an agency like us, you're going to call and say, hey, what do I do? What do I say? The doctor usually knows what to do already, but if you're faced with a situation you're confused about it, you need to be able to call a professional that can help guide you through what to say and what to do. But you can ask for exemptions when it comes to Part D prescription drugs that are not on your formulary for that particular year, and they typically are going to put that onto the formulary at a Tier 4 level. Sometimes the exemption will allow it to go on even at a lower cost. Sometimes they're a generic drug and they just put them in, and so it's all these moving parts to that. So again, if you get into a situation like that, call a professional like us. Let us help provide you some information, or ask your provider that's prescribing the medication to help you. Part D plans are part of the government's Medicare program, but they're offered and managed through approved private insurers. So just like a Medicare Advantage plan, they're offered through Medicare, but they're executed through private companies doing the prescription drug Part D benefit. So there's 4 stages. I'm going to go over this briefly, and there's 4 stages of Part D prescription drug plans. You know, some plans will have a deductible amount. That means a dollar amount that you pay before the plan really kicks in. That's what a deductible is. You pay it first, then the plan kicks in. Some prescription drug plans, a lot of Medicare Advantage plans now, don't have a Part D deductible. Or they'll have a deductible that's just associated with name brand, Tier 3, Tier 4, Tier 5 drugs. That means if you're on Tier 1 and Tier 2 generics, the deductible never kicks in for the year. But you have a deductible. Then you have this thing called the initial coverage stage, which is what you pay, the copay you pay, or coinsurance you pay, what the plan pays, and the total cost of that medication. They add that total cost together, and if it gets to a certain level, depending on what year you're in, if it gets to a certain level, you go into what they call the coverage gap or the donut hole. Now, during the donut hole years ago, you'd pay a high percentage of the cost. Now they have this regulated amount where medications, you pay 25% of the cost of the medication. Through the donut hole from the beginning of the year, from January 1st, what you have paid out of your pocket, true out-of-pocket cost out of your pocket, once that amount and you hit the donut hole, you're going to have the 75% that's paid by the plan and 25% paid by you. That 100% cost goes towards your true out-of-pocket cost. And once that dollar amount hits a certain higher threshold, what gets you into the donut hole is this threshold, and that dollar amount changes every year. So ask us or ask an agent. And then once you get to a higher dollar amount, it actually pushes you out of the coverage gap or donut hole into what they call the catastrophic or the last stage. There's 4 stages again. Stage 1 is deductible. If you don't have deductibles on your plan, then you go to the initial coverage election. That's what you pay, what they pay, and the total cost of that. If it reaches a certain dollar amount, pushes you into the coverage gap or the donut hole. To come out of the donut hole is what you've paid out of your pocket, true cost, up to a certain dollar amount, pushes you out of that into the catastrophic. And then what happens in the catastrophic stage, all the cost of your medications drop down to a 0 up to, right now it's about a $9 and something cost, or 5% of the cost of the medication, whichever one is greater, until the calendar year ends. And then what happens at December 31st that, revolutionizes everything? Well, I call it Groundhog Day. Basically, everything starts over January 1 again, and the same process every year. These 4 stages have been in place for years in the prescription drug plans. The cost of getting into those 4 stages change, but those 4 stages stay the same. Deductible, if your plan has it, initial coverage amount, the donut hole or the coverage gap, but the donut hole is what a lot, and then you go into the last stage is catastrophic, and then December 31st, everything, Groundhog Day occurs, everything starts over January 1st. So that is how a prescription drug plan works. And again, the medications, the formularies, and all that stuff. That is a lot of moving parts for most of you guys trying to figure out, what do I choose? Honestly, don't try to do it yourself. It can confuse you even more. Give us a call, allow us to be able to do a review of your medications and the plan needs that you have. And then within a few seconds, we can tell you exactly what plan of prescription drug coverage is going to cost you the least amount of money, provide coverage for your medications, and provide you access to the care that you need. Guys, we're going to take a short break, and then we'll be right back with you, and we're going to supplements and Medigap plans. Talk to you in a second. Thanks.